Hello, my name is Sherry. I'm going to be your nurse practitioner today. It's nice to meet you. So before we get started today, I just wanted to make sure you are here for just a physical examination. Is that correct?
Yes,
Okay. And when was your last physical exam?
like a month ago.
Okay, great. So first we're going to start with your past medical history. Do you have any chronic health conditions?
No,
Okay. And what about your family? Do you have any chronic diseases or issues in your family?
diabetes.
Okay, and is it on your father's side or your mother's side?
Both.
Okay, so you have diabetes on both sides of your family. Okay, and then do you take any medications on a daily basis?
Testosterone, liothyronine, and metformin.
Testosterone, liothyronine, and metformin. Okay, and do you have any allergies to any medications or environmentally?
Cephalosporins and penicillin.
Okay,
Type antibiotics.
and what kind of reactions do you have to those medications?
Cephalosporins make me feel loopy, and the penicillins give me a rash.
Okay, and as far as your social history, what do you do for a living?
I'm an IT director.
Okay, and then do you drink alcohol?
Rarely.
Okay, how often do you drink it?
A few times a year.
Okay, and then do you smoke tobacco or use any nicotine products?
No nicotine.
Okay, and do you use any illicit drugs?
I take a THC gummy before I go to bed to help me sleep.
Okay, and are you current on your immunizations that you know of?
I think so.
Okay, all right, this is a well-developed man appearing his age and who's appears to be alert and oriented and has mood is calm, affect is flat to appropriate for the situation, and speech is fluent and not hurried or too slow. And so now we're going to move on to the skin portion of the assessment. I noticed that your skin is light tan and ruddy in some places. Is it okay if I touch you? Feels warm and dry to the touch, no excess sweating. I do notice that you have multiple nevi on your neck and some cherry angiomas on your neck and forehead, as well as in your scalp line. Next part of the exam, we're going to move into where it's more hands-on. Would it be okay if I touch your scalp? Okay, I'm just going to put my gloves on here. And just looking at your scalp here, I'm just going to be touching along. Let me know if you feel any tenderness. Your hair feels to be like a moderate coarseness. It is thinning a little bit over the top of the back here. I don't see any deformities to your skull, cranium, no tenderness here.
No.
Okay. As we come around the front, I'm gonna just feel the pulses in your temples. And the pulse in your right temple feels stronger than your left, so I'd say it's a 2+ on the your right, and a 1+ on the left. Okay. I'm just going to be feeling your sinuses here across the frontal sinus. Any tenderness here?
No.
And then your maxillary sinus, any tenderness here?
No.
Okay. Can you open your jaw for me? I don't feel any clicking or popping. Can you slide your jaw side to side once it's opened? Okay. And then can you clench your teeth here? I'm just going to test the muscle here in your temporal, and relax and squeeze and relax. Okay. All right. So everything checks out there normally. Next, I'm going to be looking at your eyes. I see that this left eyelid does droop just a little bit, and I notice that you are wearing contacts. Looking at your eyes, the conjunctiva is white with a little bit of arteries present there. The sclera is pink. I don't see any lesions. Look down. I don't see any lesions or exudate. The eyelashes are evenly distributed, and yeah, everything looks good there. Okay, so next we're going to move into some more examination on your eye. So we're going to use this eye chart to have you cover up one of your eyes, and if you can, read the lowest line that you can read with your left eye.
LTFPH.
Okay, and then switch your eyes, and then read the lowest line that you can read, the smallest line. Read it backwards this time for me.
HPFTL.
Okay. All right, and that looks like you've got 20/20 with your correction there. And the next thing we're going to do is just going to look at your corneal light reflex. Just look at my nose here. I'm just going to shine the light over the bridge of your nose here, and it does appear in the same location in both eyes, and so there's no nystagmus or strabismus present. Okay, the next thing we're going to do is we're going to check your cardinal fields of gaze, checking cranial nerves 3, 4, and 6. If you can just look at the top here and follow my pen light, do not move your head. If you can keep it still. Okay, I don't see any extra ocular movements, and we have no nystagmus present. Okay, now I'm going to check your pupils, just how they're dilating to the light. Okay, and they are both equal reactive to light. I'm going to have you look across the room, and then look at my pen light, and then look across the room, and then again at my pen light. Okay. Your pupils are equal and reactive to light and accommodation, and the pupils are 4 millimeters. All right, the next thing we're going to do is the cover uncover test. So just look here at my nose. Okay, and then the other eye. All right, again, we have no extraocular eye movements, and that is a normal finding. Your eyes are very solid and stable. All right, the next thing that we are going to do is look through to test your peripheral vision. And I'm going to have you cover up one of your eyes, and close your eyes and cover it, and I'll cover up the same eye, and then you tell me when you can see my finger come into the field of vision.
Yep.
Just keep looking straight ahead.
Yep.
Okay, let's switch.
Yep.
Look at my face.
I can see your hand.
Okay.
Yes. Yeah.
Okay, good. All right, so the next thing that we are going to do, okay, let's see. We're going to be looking inside your eye. First, would check the red light reflex, but I can't turn all the lights out in here, so I can't make it pitch black dark in here, which would allow me to see it better, but we're going to check for it here. Look straight across the room there. Okay, checking for the red light reflex. And now I'm going to look inside your eyes. Okay, the fundus is a peachy color. The arterioles and venous connections, there's no nicking and no exudates or hemorrhages. Looking into your other eye. Okay. And I see the fundus on the optic disc is got sharp margins, no arterial venous nicking, no exudate, no hemorrhages. I need to look at the optic disc in this eye. Oh yes, so the optic disc also has sharp margins in that eye. Okay, good. All right, so the next thing that we are going to look at is in your ears. Oops. Okay. Now just before I start, just going to feel the external parts of the auricle? Any tenderness or pain?
No.
Okay, I don't see any redness, discharge, or drainage. I don't see any redness, discharge, or drainage in the external ear canal. Just a little bit of cerumen that's amber to yellow colored. The cone of light reflex is present. There's no bulging or retraction of the tympanic membrane, and I can see the bones there intact. And we'll look at the right ear. A little bit more yellow, dry cerumen in this ear. Cone of light reflex is in the proper location and figuration, and no retraction or bulging, no exudate, no redness, no lesions noted there. Okay, so now we're gonna move on to your nose. And just look at here. The septum and turbinates appear to be a little boggy and red, slightly moist. I'm gonna grab this part of the speculum to get a little bit better look here. Yeah, it's actually maybe a little bit slight deviation of your septum to the left. Okay, any pain or discomfort there? Okay, I don't see any lesions or ulcerations or septal perforation. Okay, so the next thing we're going to do is check the patency of your nostrils. So I want you to just cover one of your nostrils up and breathe in. Any occlusion, any difficulty with that? Okay, now switch. Okay, and now I'm just going to have you close your eyes and we'll test for smell here. What do you smell?
Mint.
Okay, and then the other nostril. What do you smell here?
Lemon.
Okay. Okie dokes. All right. So the next part of our exam, we're going to be moving into your mouth. So your lips are pink, fairly moist. Open your mouth. Let me see your teeth. Okay, you have a little bit of redness around your teeth, or around the gums as they go in. Open your mouth. Let me look at the buccal mucosa is pink and moist. A few bite marks. Hard and soft palate are intact, no lesions. Underneath the tongue, the vasculature is normal in appearance. I can see the salivary gland openings. Okay, stick your tongue out, straight out and hold it. Tongue is midline. It protrudes midline. It does not deviate. Say ah.
Ah.
Okay, uvula is midline, it does not deviate. Checking cranial nerve 9, say ah. Ah! Sorry. Sorry. Okay, so your tonsils are 2+ on bilaterally, and they are red and kind of a dark pink color. Also, while we're here, I want to check your facial movements. So can you squeeze your eyes closed for me? Okay, and then raise your eyes up on your forehead. Okay, and then smile again. Okay, and then puff out your cheeks. Okay, great. So all of those movements are symmetrical, checking more of your cranial nerves. Okay, so the next thing that we are going to check is your taste buds. 1 second here. What does that taste like?
Salty.
Salty, okay. And this one?
Sweet.
Sweet, that's correct. And this one?
Sour.
Okay, those are all correct. So your taste buds are intact. You don't have any odor to your breath. The next thing I'm going to be looking at are your lymph nodes. You have several lymph nodes throughout this area. We're going to look at your preauricular lymph nodes. your post-auricular lymph nodes, your posterior cervical lymph nodes, your tonsillar lymph nodes, your submandibular, submental, and then we'll look at the anterior cervical chain, posterior cervical chain, deep anterior, and then we're going to look at the supraclavicular lymph nodes and infraclavicular lymph nodes, which I don't feel any of your lymph nodes here. Okay, we're also going to do the whisper test. So I'm going to have you rotate your chair there, have you cover one ear, and then I'm going to say a series of letters and numbers, and I want you to repeat them back to me. Oh, okay. H, G, P, 7.
HGP7.
Okay, and the other one?
MLG9.
Okay, okay. All right, so then we're gonna actually go into checking your muscles here of your shoulders and neck. So shrug your shoulders for me and down. Okay, now shrug them with my hands. Okay. Now can you rotate your head to the side and then up and back? And now I want you to do that with a little bit of my resistance here. So ear to shoulder, head back and head down. Okay. All right, so this concludes our examination today. Thank you very much for your time, and I hope you have a great rest of your day.
Thank you.